The Career Achievement Medal is given to a federal employee who has spent 20 years or more making significant contributions to public service. Tonight, we honor someone who really leans into the or more side of things. Dr. Ira Pastan's 60 years at the National Cancer Institute have led to many significant achievements, including a new treatment for a rare form of leukemia.
Hairy cell leukemia is a cancer of cells in the bone marrow. It's called hairy cell leukemia because the cancer cells have little projections, and the person who discovered the disease said they look like hairs.
Hairy cell leukemia is often referred to as a rare disease, but rare is kind of a relative term. It is 2% of all leukemias, which works out to about 1,250 new cases per year in the US, and that's about 3 to 4 new cases per day. The main treatment for that is cladribine or pennistatin, and usually does not cure the disease, and most patients will relapse by about 16 years. So what's exciting about the drug that Dr. Pastan developed is that it's not chemotherapy, and it doesn't have chemotherapy toxicities.
So our drug is like a magic bullet or a guided missile. It has a little piece of an antibody that binds to the cancer cell and a little piece of a toxin that goes in and kills the cell.
Like any cute but fatal disease, the best way to understand it is through a cartoon.
So the drug binds to the outside of the cell to a specific protein called CD22, and then undergoes a lot of processing and trafficking. And then from there, it engages with an enzyme that makes protein. So we arrest protein synthesis, MCL1 levels fall, and that leads to cell death.
Okay, so it's not exactly Saturday morning cartoon level wacky hijinks, but it's probably more important to the world at large. The therapies that Dr. Pastan developed here could also be effective treatments for pancreatic and lung cancer, as well as mesothelioma.
Our other program is using this approach to treat solid tumors, particularly mesothelioma, with my colleague Dr. Hassan. And that drug, which is known as LMV100, is in clinical trials now for mesothelioma.
But as important as this work is, it's just the tip of the iceberg with Dr. Pastan. Over his 6-decade career, he has interacted with and mentored scientists who have gone on to be very successful in their own right. Say, for instance, Nobel Prize winner Harold Varmus.
In the summer of 1968, I was a untutored physician who was seeking a place at the NIH, and I ended up in the laboratory of Ira Pastan. And there, very quickly, under his superb direction, I learned from this young endocrinologist how to think about science, how to make use of the coming of molecular biology to clinical medicine, and how important the government is in trying to create careers for young scientists. Over the ensuing 50 or so years, Ira and I have remained in close touch, and I've watched his remarkable development as a scientist, exploiting new opportunities with fearless abandon on many occasions.
Now, I realize Dr. Pastan may be new to some of you, but old school Pastan heads like me and Francis Collins have been into him for years.
Public service for medical research is the willingness to forego maybe all kinds of other recognition, including a lot of financial recognition. Just throw yourself into trying to make discoveries that are going to help people. And Ira Pastan exemplifies all the features of that kind of dedication, that curiosity, that willingness to take risks, and to be a great trainer of the next generation.
For this and so many other reasons, I am very proud to present Dr. Ira Pastan with the Paul A. Volcker Career Achievement Medal.
I am tremendously pleased to accept this award. And I want to start by thanking my wife, Linda, who gave up a position in Boston to move to NIH so I could work there. And also, I guess, to my kids who would rather have me home playing with them than going to the lab. And I want to thank my team, we call the immunotoxin team, that helped develop this drug, particularly Bob Kreitman, who ran the clinical trials, Dave Fitzgerald, who first introduced me to the toxin we use to make the drug, and Rafid Hassan, with whom I'm working on a similar drug to treat mesothelioma and related tumors. And then, of course, there are many people in my lab and fellows and technicians and others who've helped over the years and done most of the work, and the nurses and patients who participate in the trials. And I can't think of a better place than NIH to work in the world. I grew up in a working-class suburb of Boston. My grandparents left Europe to escape persecution, and I must say it was a really good decision.